Welcome back. Fentanyl is a growing threat in Wisconsin schools. Districts are fighting back. In Wisconsin, fentanyl deaths grew by 97% in 3 years. News 8 Now's Emily Brown has more on how schools are working to protect kids.
Boxes of Narcan stocked in vending machines in the lobby of the Eau Claire County Jail. It's not the treat you'd expect to see in a snack dispenser, but the rise in fentanyl deaths across Wisconsin has left health officials with no choice.
These resources are available 24/7 to all community members.
In 2023, over 1,300 people died of opioid deaths in Wisconsin. 1,280 of those were from fentanyl. The vending machines are just one weapon in Eau Claire County Health Department's fight in the fentanyl and opioid epidemic.
For over 2 years, we have been able to dispense over 2,000 boxes of Narcan and over 1,000 fentanyl test strips.
And while you might expect to see these types of campaigns targeting folks at the county jail, they're also targeting your child's school.
We're able to provide resources to all of the schools within Eau Claire County, if that's elementary, if that's middle, high school, and even universities.
Because like it or not, the reality of opioid misuse is already there.
I know at least 2 people from my school alone that have seen SAFE, and they've started taking actions to get out of these unhealthy habits of use and vaping and different drugs.
SAFE is a student-led group that focuses on peer-related issues like drug use.
Anything peer-led, it's the best way to reach youth.
They're teaching each other truths of drug use.
How it can affect your brain, especially as teenagers while we're still developing. It can have awful effects on your development.
We have, a wide variety of different drugs that have impacted our community here in Vernon County.
The Vernon County Sheriff's Office is making the rounds too, talking to schools about fentanyl.
We go into party drugs, what they might see out in the community when they do go off to colleges.
Deputy William Raisler takes his HOPE program to 6 school districts in Vernon County, thanks to a grant from the Vernon County Opioid Prevention and Abatement Steering Committee.
To ultimately have that education on what drugs do and how they can affect their future.
The topic of fentanyl is new to these drug awareness programs, as the U.S. only started seeing its first cases back in 2013.
At that time, it was primarily heroin that included fentanyl. However, within our community, we are seeing more stimulants contain fentanyl.
It's a reality Terry Gullickson knows all too well. Her son Keaton was killed by fentanyl.
He had purchased some cocaine, and unfortunately, the cocaine that he took turned out to be 100% fentanyl, so he died immediately when he ingested it.
It's the silent killer being added to street drugs.
You can't see it, you can't taste it, and you can't smell it.
I was blown away, angry.
When Keaton died, Gullickson wasn't familiar with fentanyl.
I'm sure I heard about it, but I didn't realize exactly what it did to people.
She says programs like SAFE and HOPE are crucial.
I think they need to really push that in schools, that they don't know what they're taking when they take something. It can be in marijuana these days.
Looking back, she wishes she knew the warning signs, but hopes to help parents so they don't have to endure what she did.
Be nosy. I probably didn't check his phone enough. It's important that parents know that their kids are not immune to this, and they're naive if they think their kids aren't trying something.